I am a geriatric and palliative medicine physician, so I care for adults with serious illness and adults with disabilities who need long-term care. In my experience trying to serve a basic human need in a system driven by profit, I've seen firsthand how this system kicks people when they're down. I wish I didn't have to tell you how normal it is for us to impoverish people in order to get the care that they need. I wish I didn't have to tell you how normal it is for us to see people in the ICU because they can't afford their medications or the copays and deductibles for services they need to take care of themselves. Because our system ties health insurance to employment, millions of workers have lost their health care in the middle of a pandemic. Even before this crisis, nearly 1 in 3 Americans were uninsured or underinsured with lousy insurance, leaving them struggling to pay for care when they needed it. Now the situation is much worse. Communities hit hardest by the coronavirus largely do not have health insurance coverage at all. Quick show of hands. Raise your hand if you've ever been uninsured. Keep your hand up. Raise your hand if you've ever had a family member who's ever been uninsured. Keep your hand up. Raise your hand if you've ever not sought care because of the thousands of dollars of deductible you'd have to rack up before your insurance kicked in. Look around you. We are the uninsured and underinsured. The Medicare for All movement is a movement to save lives and reduce racial health disparities. Some people talk about Medicaid expansion, which absolutely has improved the lives of millions of Americans under the Affordable Care Act. But personally, I'm tired of telling families that they can't receive a service because that facility or provider won't take Medicaid patients. To me, having different insurance for poor people reproduces a form of medical apartheid with separate Medicaid clinics and providers, a modern day version of separate but equal. A serious fight for healthcare, racial and economic justice, for equity, demands a fight for improved Medicare for all, for everybody having the same comprehensive coverage, free at the point of service. The federal bill in the House, H.R. 1384, which will be reintroduced in the coming weeks, improves on Medicare by covering all necessary medical care, including long-term care, vision, dental, hearing aids, and mental health services for free, with no out-of-pocket costs or deductibles. 2020 has made clear the enormous value of the labor of essential workers who keep our communities going. We need to pay these workers back with both Medicare for All and with fast-track unions to protect their health and safety on the job. While essential workers are dying during this pandemic, insurance and drug companies are making record profits. Those profits come from taking bigger and bigger cuts out of our paychecks. We are already paying for Medicare for All, we're just not getting it. Our payroll deductions are bankrolling million-dollar salaries for corporate CEOs. So make no mistake, Medicare for All is an enormous threat to capital. Winning Medicare for All will require a powerful labor movement that can pose a credible threat to collectively withhold labor in key sectors, forcing the C-level executives of healthcare industry to concede, and our politicians. In this vein, I have joined the Democratic Socialists of America's Health Workers Collective and helped founded it. This is a sectoral organizing network supporting early worker self-organization on the job. We are currently launching a campaign, PRO Act, the Protect the Right to Organize Act. The PRO Act dismantles many of the anti-union laws that are a legacy of Jim Crow, banning things like voter suppression with armed intimidation at union votes. The PRO Act will make it easier to unionize, granting workers more structural power over their health and safety on the job. Are we going to let the bosses organize our society around racist abandonment and policing? Or are you and I and everyone on this call going to organize it around solidarity and care for each other, around safe jobs and saving lives? Nothing will change without you taking collective action in organization. So I ask you to join an organization, your church or a community or workplace or political organization, and have that organization join the North Carolina Medicare for All Coalition and the coalition to pass the PRO Act. The time is now. Medicare and unions for all, safe jobs, save lives. Thank you so much.